Good morning, everybody. Thank you for joining us for our press briefing. We are going to be covering several topics today, but as always, we want to remind people that we still have a pandemic going on and that it's going to be important for people to continue to follow our rules with regard to how we slow the spread of the virus here in Nebraska. Again, I know people are tired of the pandemic, but we do need to continue to remain vigilant with regard to spreading the disease to others. So, people need to continue to try and keep that 6 feet of distance between them and other people. Wear a mask if you're going to be inside in an enclosed space where not good ventilation, and you're going to be closer than 6 feet to other people. And then also make sure you wash your hands frequently. Those are all great things to be able to make sure that you're slowing the spread of virus here in Nebraska. And then also, if you see that crowded bar or restaurant, that's a great opportunity to go to another bar or restaurant to be able to make sure that you're not getting in one of those situations where you've got crowded enclosed space with a lot of people. So please, folks, continue to remember that we have to practice these things. And then the other thing, actually, I think I highlighted this in the past, and Dr. Burks, we had our White House call yesterday, was talking about this, that if what they are seeing from the contact data, and this is what we got anecdotally when we talked to our folks in the public health department, is that a lot of the spread is occurring at people's homes, if you have friends over on a Friday night or family get-togethers. And so we do need to remember that just because you know somebody, right, they can still give you the virus. So that's one of the ways that at least the folks at the federal level are seeing it, and certainly we're seeing it here in Nebraska as well. So if you're having those family get-togethers, if you're having those friends over, please remember, if you can go outside, that's going to be better. Keep 6 foot of distance between you and other people. If you're going to do inside, again, you're going to be closer to this, try and keep 6 feet apart. Still okay to wear a mask inside your own house if you're going to have people over. So those are all great ways that you'll be able to help slow the spread of the virus. Also, just on hospital data, we are looking at 26% of our hospital beds are available, 24% of our ICU beds are available, and 76% of our ventilators are available. We are seeing increased hospitalizations. I think we're up to 315 as of last night. We continue to monitor that situation. Dr. Antone is on the phone daily with all the different hospital systems, and we're going to continue to monitor that as we go forward. Test Nebraska is another great way for people to help get involved in this fight against the virus. We've delivered over 308,000 tests. And again, this is something if you're going to go see somebody, like say you're going to go see grandparents or somebody like that, getting a test ahead of time, it's a great opportunity to be able to do that, to be able to make sure that you're not going to be spreading that virus to somebody else. So testnebraska.com is one of the ways that you can get signed up. Lots of slots available, so please consider using Test Nebraska to be able to help fight the virus here. All right, so we have a number of guests here today, and we're going to start by talking about what we're doing, an update to our website with regard to the CARES Act money. So just in general, since this pandemic has begun, we have received here in the state of Nebraska nearly $10 billion in aid. Now, some of that has come through things like our coronavirus food assistance program. Some of it is the direct checks the federal government has sent out. Some of it has been the Paycheck Protection Program. Those are all ways the federal government has delivered relief directly to Nebraskans. But the state of Nebraska received over $1 billion that we are putting together as well to be able to help people out through this pandemic. And we've done that through our Community CARES Act, where we're targeting nonprofits. We've done it through our program in economic development for our businesses and livestock producers. We've provided aid to state and local governments. And then, of course, we've put money into our unemployment insurance trust fund to be able to make sure that we would be able to continue to make those payments to the folks who are on unemployment. So a variety of ways that we have leveraged that, those dollars. We have recently updated our website, coronavirus.nebraska.gov, to be able to reflect and let people see how this money is being distributed. So I talked about all those different programs. The website will be able to show folks how this is all being distributed and to whom. So with that, I'm going to bring up General Bohack, who's our Adjutant General for the Nebraska National Guard, and he is going to walk through, as the person who's in charge of NEMA, we're going to have him walk through our new website and what you'll be able to see and the availability of the transparency that we've got as to where these CARES Act dollars are going. So with that, General Bohack, I'm going to call you up here. And, you know, we were talking about this earlier. We're going to get to this in a minute, the Center of Operational Excellence Month. But, you know, you could just start by talking about the values that we have here at the state of Nebraska.
thought I'd embed them in my remarks, guys.
That's awesome. That's awesome. All right, great. Because transparency is one of those remarks. So,
Thank you. Well, good morning, everyone. I am pleased, and this has really been a team effort across state agencies and with Deloitte that's supporting our work in the administration of the Coronavirus Relief Fund, to talk about the dashboard feature that is actually live on the website as we speak. So you could go there. If you go to the website, as the governor talked about, and click on Coronavirus Relief Fund, it'll take you to this page. So you'll see this right above this will show you the total amount dispersed so far, and as of September 30th of this year, it's $587,723.57. So, and then over 20,000 different awards having been made so far through the administration of this program. Some of the great features that we built into it to meet some of the values that the governor was just talking about in terms of transparency and accountability is to give any interested citizen, anyone that's interested, to be able to go here to the dashboard and look at the data in a number of different ways, to include sorting by program names. So the governor mentioned DHHS Community Care's suite of programs, Department of Economic Development suite of programs, as well as the other money we've administered to local governments and state agencies. And then you can also then go specifically to a specific grant type if you want, or you could search by recipient if you were interested in some specific business or individual producer, livestock producer, for example. Other features of the dashboard include an ability to look at things by city, by county, by legislative district, and by congressional district in the state of Nebraska, and look how the funds have been administered across the state in a variety of different ways. And then finally, I think one of the possibly one of the best features here is this download data file that you see. Once you've done your sort and the way you want to look at the data, you can hit that. It'll download an Excel data sheet onto your desktop or onto your device, and then you can use that to look at that data more in your own time and ways. So we think this is definitely increasing the transparency of how we're administering the fund over time. And we'll continue to update this on a weekly basis, with Deloitte as in the background doing all the data support for us and pulling that from various state agencies and other sources to make sure we're current. So glad to introduce this, Governor, and have this dashboard up and running.
You talked about two of our values, Governor. But what about General, what about the other ones?
Well, I did talk about team, sir, so that's one of it, the team, right? The taxpayer, so the taxpayer having access to government, and also integrity and respect being our other values that we have in state government.
Great, thank you, General.
Did I pass, sir?
You passed.
Thank you.
Good job, General, you passed. All right, so thank you very much, General. So again, a great opportunity for people to be able to find out where the money that we've been distributing to folks to be able to help them get through the pandemic is going. So thank you very much. Again, that's coronavirus.nebraska.gov. So October is Manufacturing Month here in Nebraska, but it's also Center of Operational Excellence Month here in Nebraska. And they're actually kind of tied together because many manufacturers use the same Lean Six Sigma type process we use here at the state of Nebraska to be able to drive better improvement in their operations. And that's what our Center of Operational Excellence is all about. And so we take the month of October to celebrate the great successes the Center of Operational Excellence has had. Now, taking a step back, what is this about? Well, in my administration, what we want to do is we want to make sure Nebraskans are spending less time waiting in line, on hold, filling out forms. We want them to have a great customer experience. And if you think about what is going on in the private sector, think about companies like Amazon that are really driving excellence, great customer service. Innovation in this country is amazing. American companies are leaders in innovation. And when you see that kind of high level of operational excellence and customer service in the private sector, people expect that from state government as well. And so we have to work to be able to deliver that. And that's what we've done by creating our Center of Operational Excellence. This is something we created back in 2015, or set it up. And basically what it is, it's creating the center to be able to assist all of our agencies with process improvement, helping them to take a look at how do I do things and how can I improve them? How can I make sure I'm taking out steps that are unnecessary, get rid of the waste, find ways to be able to improve the customer experience? And that's what our Center of Operational Excellence has done. So we have our process improvement coordinators, which work with our agencies to be able to help them with their processes. In fact, we have done over 450 process improvement projects over the course of starting in 2016 when the center started doing their first projects. And then that has saved our teammates 540,000 hours of time across 18 different agencies where we've had these projects. So we've seen a tremendous benefit. And I'll talk about, we're going to have some of the folks here that are going to talk a little bit more about it, but I'm just going to hit upon one real quick in our Department of Transportation. One of the things we do in our Department of Transportation is we have to make sure that ourselves and our contractors are meeting our environmental obligations. So we have these things called green sheets, which highlight, when you're working on the construction projects, the things you have to do with regard to, say, erosion or endangered species or historic, or how do you dispose of hazardous materials. All these things are put in the green sheets to make sure that we're complying with environmental rules and we're taking care of the environment, that we're being good stewards. And also ensures that our contractors who are doing the work are doing the same, making sure they're complying with all of our environmental standards. Well, this is a process that they looked at to see how can we improve this. How can we make sure these green sheets are getting out in a timely manner? So they went through the process improvement process. They changed the way they were doing it to move it from paper to electronic distribution, for example. They were able to cut out about 27 steps. It went from 87 steps down to 60. And by doing that, they were able to reduce the amount of time it took for the lead time for this from 16 days down to 3 days, which was an 81% reduction in the amount of time it took to be able to get that out. So again, that's a great example of how we're being great stewards of the environment and getting Nebraskans moving on our highways and byways. So great example of operational excellence in action. And so we've got some speakers here today. They're going to continue to talk about that. We've got our Director for the Department of Administrative Services, Jason Jackson, who's going to talk. And then is Angie coming after you? Right, so Angie Ling, who's our Incident Commander of the Department of Health and Human Services. Then we got John Albin, who's the Labor Commissioner, who's going to talk about what they're doing in the Department of Labor. And then finally, Matt Singh, who is going to come and talk a little bit about what he's doing as the Director for the Center of Operational Excellence. So we got a great lineup of speakers, and we're going to get into them shortly. But before we do that, I'm just going to quickly sign this proclamation proclaiming it Center of Operational Excellence Month here in Nebraska. And we are officially proclaimed. And with that, Jason, I'm going to have you come up and let's start talking about how we're improving our customer service and our processes for the state of Nebraska.
Great. Thank you, Governor, for the opportunity and for your leadership, sir. In the early days of this administration, the governor had the wisdom to say, hey, organizations don't reach their potential unless they're all working from a common mission. And so the governor established the mission for state government of creating effective, efficient, and customer-focused services so that we could grow Nebraska. And that's been our focus across the administration. And he also had the wisdom of saying we can't just declare this mission and expect it to be achieved. We also have to give our teammates the support, the tools, the processes, and the skills to be able to deliver upon that mission. In the Department of Administrative Services, it's been our honor to start the Center of Operational Excellence and see it grow into the organization that it is today. To date, we have 29 process improvement coordinators deployed throughout our agencies, working alongside and shoulder to shoulder with leaders throughout state government to help their processes and services be more effective and efficient and customer focused. We have over 4,200 yellow belts trained across the whole enterprise, giving frontline leaders the tools, the techniques, and the resources to be able to show up in the context of their small teams and deliver on just the run the business, basic blocking and tackling of delivering great services day after day. So that's been a wonderful success. And of course, just last year, the Center of Operational Excellence and the Ricketts administration was recognized by the National Association of State Chief Administrative Officers, as well as the Harvard Business Institute, with having the leading process improvement organization and program in state governments across the country. So it's been quite an honor to see the Center of Operational Excellence mature to this point. But what's been really remarkable is as the state has confronted the emergency associated with the pandemic this year, the way in which our teammates across state government have been able to respond to that emergency condition and support our citizens throughout the state. And I have little doubt that we wouldn't have had the successes that we've had, but for the capability that we've been able to build throughout state government in terms of process improvement, continuous improvement, and operational excellence generally. Within the Department of Administrative Services, one of the things that we're responsible for through our material division has been the procurement and ultimately the distribution of PPE throughout the state to our local 19 public health districts. That required, if you recall back to the early days of the pandemic, just a huge surge of resources and really creating new processes and new distribution networks completely from scratch. It required innovation, it required continuous improvement, it required deep customer empathy and understanding what needed to happen, as well as just the operational acumen to create that organization where none had been before. And so our material division, in partnership with the Guard and with our depot down at Surplus Property, began the process of ordering all the PPE we need and then ultimately creating a distribution network that would get that PPE into the hands of those that need it out in the field. We also created a front-end portal, which really became the key for local public health districts and hospitals and healthcare providers and long-term care facilities and all those who need PPE to provide their inputs to the state about what their need was. And then we leveraged the buying power of the state as a whole to go out and obtain all that PPE, aggregating that need, using the buying power of the state to procure that PPE, and then the distribution network that we established to get it in the hands of those that needed it. And that was really a scrappy effort in the early days, but we didn't stop there. And that's where the continuous improvement comes in. Because even as we created that in those early days, we continued to get feedback from our customers, from our healthcare providers, from the facilities that were the beneficiaries of the PPE, and from the local public health districts about ways in which we could improve upon that front-end experience to make it better, to speed the delivery of PPE, to make sure that we were getting the right goods in the hands of those that need it, and when they need it, and that we could prioritize based upon those who were most in need while creating a very intuitive experience on the front end. So I want to pause and take a moment. My state procurement officer, Director Doug Carlson, is with us in the room as well. I want to acknowledge his leadership and just really a Herculean effort to be able to respond to that need. The totality of those efforts have put Nebraska in a very favorable operational position with respect to our supply. We were the first state in the country to achieve 120 days of surplus supply for PPE, and we're still one of the few that are maintaining a repository of over 90 days of supply of needed PPE based on current run rates. So just a wonderful success story from administrative services. And again, I'm not sure it would have been achievable but for the capability that we've built from continuous improvement and operational excellence, and a great example of how the Center of Operational Excellence has helped our entire state team really improve our operational performance. So before I hand it off, I want to, again, thank you, Governor, for your leadership in establishing this program throughout state government. Thank Matt Singh, our director of the Center of Operational Excellence, who will be speaking later in the program. And then again, acknowledge Doug Carlson, our state procurement officer, and really the entire DAS team for their work in response to this pandemic. With that, I will go ahead and hand it over to our next speaker. And we're joined today by a number of state leaders that have leveraged these similar practices in response to the pandemic. And so next, Angela Ling, our incident commander with DHHS, will come on up.
Thank you. Good morning. This pandemic has been hard and has humbled us all. We have learned many things this year, and the Department of Health and Human Services has truly adapted and overcome many obstacles. In the early stages of this pandemic, DHHS was aware there were programs we did not have the staffing to support to stand up these operations. These included mass testing events, the Nebraska Accommodation Project, and PPE distribution. DHHS asked the assistance of the National Guard, and they responded, sending hundreds of service members to support the pandemic response. I was happy to have been among those who served Nebraska in this effort. The Accommodations Project quickly developed from concept to fruition in April. The National Guard worked closely with DHHS to help provide staff, supplies, and stand up these housing locations to allow first responders and healthcare workers a place to stay when exposed to COVID-19. This quickly expanded to services for all Nebraskans, including teachers and school staff. We were able to work with community partners across the state to garner hotels and campuses to provide this housing need. We were able to create an online portal to streamline applications, allowing quick processing of applications and guest placement. We created guidance and messaging in multiple languages. We worked with established community groups to help carry this message about availability of services to assure equitable access to all. At our isolation sites, we provided healthcare, medications, personal supplies, meals, and laundry services to our guests. The National Guard was also integral in mass testing across the state. In early stages, when we had limited testing supplies, the epidemiologists would identify the target areas for testing and then hand that information over to the National Guard, who then communicated with local health departments and emergency managers to plan all the details for these testing events. As this process continued, we learned many things. For example, it was easier to test in indoor locations because the weather in Nebraska is unpredictable and the wind is not forgiving to mobile tents. Again, communities came together and found bus barns, maintenance buildings, fire halls, and fairground buildings that we could utilize to safely test our citizens. Many of these facilities are still being used for testing today. As the testing continued, there was a need for what we called strike teams. This was when we would send a smaller team into a hotspot to do testing. For example, nursing homes, regional centers, and meatpacking plants. There were many unique details about these events to ensure the safety of the testing team, but also the safety of those who lived and worked there. These little details were so important to get right, and we utilized our subject matter experts within DHHS and our community partners to ensure proper PPE and appropriate venues to keep everyone safe. These programs allowed us to learn a lot in a short amount of time, and we are still refining our practices. And through ongoing process improvement, they continue to develop every day. DHHS is thankful for the National Guard answering our call for assistance and all of the community partners who have stepped up during this pandemic. We would be unable to provide these services without you. Thank you. Next, I'd like to introduce John Albin with the Department of Labor.
Thank you, Angie. Thank you, Governor. As soon as the pandemic began to impact workers and employers in the state, the department knew we had to look at our processes and come up with new ways to be as efficient as possible for the benefit of our customers. The Department of Labor, we are fortunate to have leaders within the agency who have extensive Lean Six Sigma training. We have a black belt, a green belt, and several executive green belts, and we also have an internal goal within our department that all of our teammates will be at least yellow belt certified early on in their careers with the Department of Labor. This team worked together to quickly find ways to streamline processing benefits for our customers as we experienced the unprecedented surge of the pandemic outbreak. Just to give you some scope of the issues that we faced in the first 4 months of the pandemic outbreak, we basically took in 4 years' worth of claims. Obviously, no agency anywhere is in at least a Department of Labor type of agency, is not in a position to handle that claim without making a lot of adjustments on the fly. A part of the Lean Six Sigma training is when you have processes where you need to increase the speed or to remove problem is to go through and you try and identify where the bottlenecks are and then ask the 5 whys of why that bottleneck occurs and if you how you can fix it. Obviously, with that many claims in that short a period of time, there were a lot of them, and time doesn't allow me to talk about all of the methods that we used or utilized our Lean Six Sigma training to improve the process. But one of them we identified, but we did try and identify the areas where the bottlenecks were. And one of the areas that we identified was the processing of the claims. Nebraska, historically, unlike other states, looks at the entire employment history of an individual as they come through and adjudicates each of those separations that may occur in their base period. And you might be surprised to know that it's typical to see 6 to 10 employment separations during that base period. With the pandemic, it really wasn't the person's employment history that we needed to look at, it was what was causing the current unemployment of that person. So when we identified that process, it was like, okay, we can do 10 adjudications on each claim, or we can do the one that really matters, and that's why is that person currently employed, and move on and get on to the next claim, because there were, as I said, a lot of claims in a short period of time. So one of the methods that we used and identified that with the cooperation of the governor, and thank you very much for that, was to use the executive orders authority of the governor during the pandemic to suspend certain parts of it. And in this case, we were non-charging benefits as it was because of the pandemic, because really no employer had control over why they were shutting down at that point. But we concentrated on just adjudicating that final claim. Why was that person filing their unemployment claim now, and what could we do, and were they eligible for benefits under that circumstance? We also shifted a little bit on the work search. By statute, there's a work search requirement. We suspended that work search requirement because in a pandemic, when everyone is closing down, there's not a job to go to look for anyway, and it didn't make sense to make people go through the hoops. Plus, we were trying to limit contacts, and the system that was set up was designed for in-person contacts, which was, a lot of the places were locked. So again, we turned to the executive order to suspend that regulation and statute for the purpose and waive the work search for that time period. Then once we got to July and things started to turn around, we've reinstated the work search because it's time for the economy's reopening and we need to go back to work and our claimants need to go back to work. Another thing that we did in that process was we looked at when we were looking at those work search requirements, was how we had them conducted. Normally, in the past, we'd had them conducted, it was definitely the old in-person contact bias in the process. In a pandemic world with virtual people working from home, people need to be able to search for work from home, and there are other alternatives. So we adapted our regulations so that it would be easier for people to look for work and use more expansive methods. It used to be you couldn't count. If you went to a job fair and you talked to 30 employers, that didn't count unless you actually applied with one of them. So that was silly. So our new regulations would allow that to occur. Another thing we did was be able to adjust our availability issues as we went on. Another issue that we had to confront, and we applied our Lean Six Sigma process on, was the filing of claims. We've gone in Nebraska to an almost exclusively internet claims, around 97% filed via the internet. But we recognize that a lot of individuals do not have internet access. And so unlike most states, Nebraska kept its office open. We used the PPE to protect our workers so that individuals could still access our job centers. I think we are probably the only state that did not close the majority of its job centers, and the only one that we closed was one where it was housed in a community college, and they shut the doors on the community college, so we literally couldn't get into the building. But one of the key areas was in Omaha, because we recognize, and especially in North Omaha, there's a particular pocket of poverty there, and the access to the internet is not and broadband is not as available as it is elsewhere. And we were looking at that process, and we looked at the Heartland communities, Heartland Workforce Services, where our offices are located, and it looked like it was pretty probable they were going to close down. Well, we realized that would create a huge bottleneck and for our claimant. So we reached out to our partners at Metro Community College and managed to, on the fly, create an immediate open office there. So we'd actually never closed down in Omaha, even though the offices where we normally are at are working. And we served in that Omaha office over 2,462 different customers during that time period. We also made a concerted search to provide searches virtually. Of the 32,000 people that we served in that time period, 21,000 of those came in or serviced virtually, so they did not have to come into the office, whether it was transportation or fear of COVID transmission or whatever, we got them served. So, during that time period, during that crush, we were able to get 85% of our, almost 86% of our customers served within 28 days, their benefits first payment within that time period. So we felt like we made our goals. So, and we used Lean Six Sigma on a daily basis. I mean, it comes to the point where you're not even really thinking it, you're just doing it. It's just a natural process. So the pandemic has brought about unprecedented challenges for the agency. Each of our divisions, along with our partners, continues to adapt and take on these challenges and provide quality customer service to workers and employers impacted by COVID-19. And I think I'm over my time, so I will turn the podium over to Matt Singh from the Center of Operational Excellence.
Hey guys, I'm Matthew Singh, the Director of the Center of Operational Excellence. In 2015 and 16, our goal was to create a culture of innovation, of continuous improvement, of managing change. In 2017, we really started to solidify our project management methodology using Lean Six Sigma that the governor talked about, really fine-tuning our project ability, which ultimately produced hundreds and hundreds of projects here at the state to improve the services to the customers. In 2018, we took a look around and said there might be opportunity to not just do this in the agencies themselves, but to look at the enterprise as a whole. How do we do continuous improvement projects that impact several agencies across many different buckets? In 2019, we launched what's called the Black Belt program. The Black Belt program are highly trained and skilled project managers. They're experts on continuous improvement, and they work directly with the Center of Operational Excellence to do some of the bigger projects that impact several different agencies. 2020, we've done several Black Belt projects. We've helped with the implementation of the Business One-Stop Portal, which is a one-stop place for entrepreneurs to go to get all their filings, make it more convenient for them. We have helped with projects that impact the federal level and the state level partnerships. We worked on projects with project management facilitation to help make that a better process from both perspectives. We've done analysis that impacts every single state agency to determine of the 400 or 500 projects we've done, which projects are the most impactful for the customers, and getting that data in one-page handouts to all the different agencies so they know how to best approach continuous improvement. Also, later this year, we're looking to certify 2 more black belts into the program, which should expand our bandwidth. And in the future, we hope to continue to add to this program and to use this program. Like the green belt levels, the yellow belt, the white belt, and all the different trainings we do, the focus of the black belt program is to help Nebraska be as effective, efficient, and customer-focused as it possibly can be. So with that, that's a quick update on the black belt program. I thank you for your time, and I want to hand it back over to Governor Pete Ricketts.
Thank you very much, Matt. And thank you, John and Jason and Angie. Appreciate all your help with the Center of Operational Excellence. Of course, General, thank you very much for bringing us up to date on the new website. We do have some proclamations we'll give you when we're going to take a picture a little bit later. We'll do questions first, but we'll get you that proclamation so you can take that with the picture. All right, so now we'll go to questions. We had at least a couple here. Julie Anderson, the Omaha World Herald. Are you concerned about the recent increase in COVID-19 cases? Do you plan any changes in how you're addressing the pandemic? Again, we are at a high with 315 hospitalizations, and so Dr. Antone continues to engage all the hospital systems with regard to their capacity. To put that in perspective, that's a little bit under 8% of our total hospital beds here in the state. And of course, we're just going to continue to evaluate the actions and steps we're taking as we go forward. So we'll continue to monitor that situation. And then Taylor, I think you said there was another one texted in. Taylor, were you?
So
Yeah.
Don Walton says, do you support the White House's policy of what he says appears to be allowing coronavirus to spread in order to develop herd immunity?
So Don Walton, the Journal-Star, is asking, do I support the White House policy of what appears to be allowing the coronavirus to spread to gain herd immunity? I was just on the call with the White House yesterday, and there was no such policy with regard to that. And as we continue to work here in Nebraska to be able to slow the spread of the virus, we just got to continue to do all the things we've been talking about. You know, again, the tools we got with regard to staying that 6 foot of distance, washing your hands, wearing that mask when you go into a store, avoiding crowded places like crowded bars and restaurants. Those are all kind of things that we need to do to be able to slow the spread of the virus to ultimately preserve our hospital system. So that's the way we're running it here in Nebraska. And again, I was just on the call yesterday, and we were talking about, again, just where the White House is seeing some of the cases spread. I mentioned Dr. Birx talking about these family gatherings. So the White House, from my perspective, continues to work on how we mitigate the spread of the virus and, of course, continue to provide resources to be able to allow states to respond.
And Julie Anderson had a follow-up question. Is it time to reimpose some of the directed health measures we've had before, such as limiting crowd sizes since so many are gathering in groups or even crowds, like the party plan at the Pinnacle Bank Arena?
So the question from Julie Anderson, to follow up from the Omaha World Herald, was, is it time to reimplement some of the steps that we had in the DHMs, like limiting crowd sizes? You know, we're looking at the data that we have from our contact tracing, and I'll tell you just in general, as you look across where those cases are coming from, there's not a particular one that seems to jump out like big crowd sizes. But we're going to continue to evaluate the data and continue to work with our public health departments and continue to monitor where we are with regard to hospitalizations and certainly make changes as we feel are necessary. All right, questions from inside the room? Andrew.
Apparently, a couple of the hospital systems we're talking about, they have plenty of bed and ventilator capacity, but what they're running into is staffing issues. They also said that the state was helping to work on it. Can you expand on what the state is doing to help hospitals expand on their staffing capacity?
So the question from Andrew was, one of the things that hospitals are talking about is maybe having the physical space or the ventilators, the equipment, but needing to have additional staff, and had made the comment to Andrew that the state was helping with that. We are looking at how we can provide additional resources to those hospitals, but I'd say just stay tuned. We're not prepared to make that announcement quite yet.
And then, I guess, on what avenues are you doing that? Is to try to get more travelers, orders for travelers, or you know, I guess, how do you do that? If there's a general shortage all around the country.
So the question Andrew said is, how do you do that? And I would say, just stay tuned. We'll have an announcement where we've got all the details worked out.
We seem
Yeah,
to be
Fred.
getting mixed messages. UNMC had a news conference October 5th saying we could run out of hospital space. CHI and Brian had one yesterday that said, no, we're okay. Aside from monitoring, can you characterize what direction you think we're headed in, what your level of concern is?
So the question was, Fred from Fred Knapp is saying, hey, we seem to be getting mixed messages. UNMC had a press conference last week saying they were concerned about the hospital capacity. CHI, Brian, there was the article in the Journal-Star, I think today or yesterday, talking about how in Lincoln there is no capacity problems here, and CHI talking about how they could expand capacity. And again, we are in conversation with the folks at all those hospital systems with regard to where their capacity is. You know, hospitals typically run at 90% capacity, and so we're just continuing to work with them with regard to what their needs are and what they're seeing with regard to how they're managing their capacity issues. And then also, I think that, again, if you look at, you know, one of the things I encouraged was to make sure there's good communication. For example, at UNMC, that, you know, Dr. Harris Frankel, who is their CMO, was communicating with some of the other doctors with regard to what our plans were and how we were managing this. So I think part of it's a communication issue sometimes within the hospital systems as well. Andrew.
What's your view on trick-or-treating?
What's my view on trick-or-treating? You know what? Just like everything else through this pandemic, I believe we can have Halloween and kids can go trick-or-treating, but we're going to have to manage that. We've had conversations with our public health directors, and I know that they are working on some recommendations with regard to how to do this and still mitigate the, slow the spread of the virus. So it might involve, for example, creating individual packages of candy and leaving them out on your doorstep and having people come. I was listening to the radio today, and somebody was talking about having a little chute to go from your door to put the candy in and have it run down to the kid's bag so you can keep that 6 foot of distance. Some people may not want to go to that much trouble, but I think there are ways that we can have Halloween and still do it in a way that we can slow the spread of the virus and keep that 6 foot of distance and so forth.
And with tailgating coming up around the corner, I mean, how do we do that? Can we do that? Can we go to the Pinnacle Bank and do a watch party? Can we do those types of things that we normally do on Husker, game day?
So again, the question was, well, what about tailgating and, going to the Pinnacle Bank Arena and that sort of thing? And again, folks, this all gets back to, we can do this, but we have to manage it. It can't be like it was in the past. So what you're gonna have to do, just like with Halloween, maybe make some adjustments to how you deliver the candy so that you're not having that personal interaction with so many kids coming to your door and so forth. Same thing with regard to the tailgating. It's gonna have to be different. If you're gonna have a tailgate, do it outside, keep people 6 feet apart, wear masks if you can't maintain that 6 foot of distance. Those are the sorts of things that we can do to be able to, keep that distance on the tailgating. With regard to the Pinnacle Bank Arena, same sort of thing. What we've seen be successful in other venues, for example, we had the Burwell Rodeo. I can't remember, it was 3,000 or 5,000 people attended that. That was an outdoor event, and they didn't have any cases come out of that. You can manage this in a way to make sure that you're spreading people out, keeping family groups together, cohorting people, temperature checks, masks. These are all the sort of things that will help mitigate the spread of the virus so that you can still do those events, but you're gonna have to make those adjustments. And again, this is why, with regard to our DHMs, if you're going to have those crowd sizes of 500 people or more, you still have to have a plan to mitigate that and submit it and have it approved by your local public health director. And with the exception being of Omaha, then it's 1,000 people, but everywhere else in the state, it's 500 people. You still have to have that plan approved by your local public health director.
And shifting the topic a little bit, but going back to your coronavirus,
Website?
Yeah. How confident are you that we're going to spend all the money, the CARES Act money, before December 30th?
So the question Andrew asked is, how confident am I that we're going to be able to use all the over $1 billion the federal government gave the state before December 30th? I am very confident that we will get all that money out the door by December 30th. We will find uses for everything. We will not be giving any money back.
Governor, I don't know whether this is a state question or a Lancaster County question, but I went past the DMV this morning, and there was a line of people waiting to get into the building, standing out in the parking lot 6 feet apart, backed up across the parking lot. Is that a state issue or a?
So so what Fred's asking, there was a line in front of the DMV. People were spread 6 feet apart. Is that what you said?
Yeah.
Yeah, good, because that's what they're supposed to be doing. We purposely spread those folks out so that they would have that physical distancing. And, again, with regard to the DMV, we've got rules with regard to make sure we're mitigating the spread of the virus. And it could just be that this was a rush time. I know that we focus on how long it takes people to get in and get out. But I don't know what our time specifically at the Lancaster facility is right off the top of my head, but we can certainly get that information for you.
I just wonder what's gonna happen when it gets cold.
And then the question is, what happens when it gets cold? We'll have to take a look at that as we, again, are still going to have to, as long as we're continuing to space people out, we may have to make some different accommodations with regard to it when the weather turns. But I think that's a good point to highlight, though, just in general, is people to be thoughtful about the things they're doing today, where they are utilizing the outside. And as it gets colder, people are going to be spending more time inside, which is, again, all the more reason why you should wear a mask when you're going to be closer than 6 feet from somebody inside.
Have you done anything as to try to eliminate some of those early voting lines that we're seeing in other states?
So the question was, have we done anything to eliminate early voting lines? Well, again, what we saw in our primaries, about 80% of the people voted early ballot. And so to my knowledge, we didn't see a whole lot of lines. Now, that may change here for the November election. But again, the same sort of thing will have to happen where people have to be spread out 6 feet apart and so forth. We'll have PPE for all the poll workers. Again, if you're going inside, please wear a mask. You know, you're gonna be inside in an enclosed area, while you probably won't be more than, they'll probably structure the ballots or the voting booths so that you can be 6 feet apart. At least it was when I went voting in the primary. Just be mindful of all those sort of things as you're going to go vote, if you're gonna go vote in person.
And I don't think I've got a chance to ask you this, but what's your reaction to the plot against some of the, the governors? That they were trying to kidnap some of these governors prior to the election, some of these groups. Just your reaction to that and what you would have to say about groups like that.
So the question was, what is my reaction to the plot by some of these groups to kidnap governors? You know, we've got a very good system of public safety here in Nebraska. Our state patrol does a fantastic job. I don't believe there were any threats with regard to me individually, and I don't know about what was going on in the other states, but certainly you're going to have fringe groups everywhere that are going to be talking about crazy ideas. The internet only allows those people to contact each other more easily. But we've got great law enforcement who work to keep me safe, and I know we got great law enforcement that are working to keep all of our other governors safe as well, and I've got a lot of confidence in their abilities. All right, any other questions? Seeing none, Taylor, let's go ahead and take a group photo here if we could. I've got some proclamations here. Oh, but as we wrap up, again, just want to remind people, wash your hands, wear that mask, stay that 6 feet of distance. Thank you, Sharon, for jumping back in. Good job. All of our social distancing rules, avoid crowded bars and restaurants. We got to continue to continue to avoid spreading the virus. Everybody can be a part of that. Of course, signing up for Test Nebraska is another way for people to continue to make sure that we're slowing the spread of the virus. Thank you, Sharon. Good job. All right, Taylor.